I'm going to talk briefly about our special adoption program. So dogs who have significant fears, aggression over food, mild stranger aggression, mild to moderate stranger aggression, mild to moderate dog aggression, and certainly some, we've had dogs that fall into the severe category as well. Separation anxiety, chronic house training problems, jumpy, mouthy dogs. Many of dogs with these problems are dogs that fall into our special adoption programs, which I'm going to talk about next. And as I said, I feel this is one of the most valuable things that we do in terms of successfully rehoming. And so initially, our special adoptions, they're flagged as special adoptions. Everyone in the shelter knows that they're special adoptions. The potential adopter meets the pet and is screened by our absolutely amazing adoption counselors through the normal adoption counselors. They do an amazing job. Usually when they give something to me as a special adoption saying, I think this is a good match, 99% of the time it is. If they think it's suitable, they send a special adoption form to our behavior department. And the special adoption counselor, there's some shelter people who are special adoption counselors as well as some behavior department people who are counselors. We call that potential adopter, and if that adopter appears to be a suitable candidate, we schedule a behavior appointment that lasts about 30 minutes. During that phone call, we go over the form that they filled out that asks things like, what is your ideal pet? What is not acceptable in a pet? And 90% of people on the what is not acceptable say aggression, and usually a couple other things besides that. And so I call them and I say, you want to adopt Jackie Boy. You said that aggression is not acceptable to you, but Jackie Boy does display aggressive behavior. We're always very clear, very honest, very forthright. Most people, when they write down that word aggression in our community, are saying they don't want a dog that they can't love and hug and handle, but a dog that they can manage easily by avoiding certain things they are more than happy to take. So we provide full disclosure. We send the client home with a document that writes out the dog's behavior in the shelter, in its previous home, and on evaluation that they sign, acknowledging that they are aware of everything that's going on with the dog. And they also go home with instructions. As I was preparing this lecture, I had a question. That's a lot we put some of these people through in terms of having them get a pet into their home, and sometimes an aggressive pet into their home. So does it deter people? My experience is that the problem itself sometimes deters people, and for me that's appropriate. If you're not someone who's comfortable with a dog with food aggression, I don't want you to take a dog with food aggression, so I think that's normal and appropriate. But most people really, really appreciate the level of care that we provide, and we very, very frequently get comments about how amazing our support is to them and how nice all the counseling they got was. Rarely they are deterred and they will find a pet elsewhere. That's something that we find acceptable in our book. We have a but we have a low return rate for our special adoptions as well as our regular adoptions. Less than 10% of our special adoptions are returned. So that's telling us that we're doing a pretty decent job. So examples of recommendations that we would make. Our focus is on safety and avoidance of the problem. So we don't allow the dog, for a food aggression example, access to bones and valuable items unless they're in a crate or kennel, or we don't give them at all. We allow the dog to eat in peace. We don't disturb him while he's eating, and we never, ever, ever take something from their mouth. That last instruction is where we tend to have the most challenges and problems. People have a really, really hard time with the thought that you can't, if your dog has something, you shouldn't just open the dog's mouth and take it out. So we very much focus on, if the dog has something that you think is very valuable, your job is go to the kitchen, go to the fridge, grab a piece of chicken, take it out, and trade the dog for the chicken. We're very, very successful when we teach people about that recommendation. The best part, going home. This is a wonderful, wonderful man named Dennis Heafy. Dennis Heafy has very limited use of his arms, no use of his legs, an amazingly inspirational man who I'm almost going to cry just thinking about him. He wanted a companion. He didn't want a service dog. He wanted a companion. And he had been to other shelters trying to find a companion, and people looked at him and said, how can you take care of a dog? And he can. He has aides who help him, and he's an amazingly resourceful dog. He's trained this dog to open up doors. He's trained this dog to do things to help him in many ways. He's an intelligent, resourceful man. And by us being flexible and recognizing that he's an individual, as well as Vinny is a special adoption. He's a rat terrier-looking dog who came from a hoarding situation with about 17 to 18 rat terriers. He was not handleable at first. I fostered him in my home for about 6 weeks before he came into the shelter, and we worked with him there. And at the time he went home with Dennis, Vinny didn't love people touching him. And so Dennis was a perfect match for Vinny because Dennis can't touch him or can touch him only in a very limited way. Vinny has since become very, very friendly, and they have found ways to interact with each other, and they're very, very happy with each other. So bottom line, it's just being acceptable, being flexible, accepting dogs for who they are, accepting people who they are, and making good decisions for them. Follow-up for our special adoptions. We phone our adopter at 1 week, 1 month, 2 months, and 3 months, sooner than 1 week if we have any special concerns. And we have specific questions that we ask about how the dog is doing. And then in terms of follow-up, we do offer a 50% discount on training classes through our shelter for any dog that's adopted. And for dogs and cats, we offer free behavior appointments for 6 months after adoption. So Dennis, the guy you saw in that picture, has utilized, we've probably seen him about 6 times to help him with basic training. And that is it. Thank you very much.